Girls, we want to meet you where you are. Welcome to Dare to Ask, Episode 12, Straighten the Neck.
I worked with my hands. I got healing hands.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
I just think that personal connection allows my patients to be a little bit more vulnerable.
She literally has healing hands. And it's not lost on her what a privilege that is for Dr. Alli Klug. On this season's final episode of Season 1, we'll get the opportunity to speak with a female provider who is living her dream of combining chiropractic care within a medical healthcare hospital. Why did this young doctor even dream this? And what her personal life looks like. I'm going to ask the weird question about if chiros really love hearing the crack after an adjustment. You know what I'm talking about. And also, since we have a chiropractor here, this is a field that is shroud in myth. And so we're going to bust some of those too. Let's get to it. Your patients call you
Alli.
Alli.
Yes.
So no Dr. Klug, we can put that formality on the side?
I think so.
Informal, if you will.
I just think that white coat syndrome is very real. I do have my doctorate degree. I am a doctor. I just think that personal connection allows my patients to be a little bit more vulnerable with me.
Yeah.
And I do see my patients a little bit more frequently. So we do get a little bit deeper of a connection, talk about more day-to-day things, what's coming up. And I just like Alli, or some call me Al, which is kind of...
I love it. Some people call me Core, so I understand. And I can tell already I'm going to like you. If connection is what drives you, it's about relationships at the end of the day, no matter what business you're in.
100%.
Are you a stay-in or a eat-out?
Ooh, well, here's the problem. I'm married. So I'm definitely an eat-out type girl. And my husband is very much a we have food at home type guy. So
I'm married to somebody exactly like that. Are you more girly girl or are you more tomboy?
I am probably more tomboy. However, the older I get, the more I'm embracing the girly girl things. Like pedicures, jewelry. I don't dabble much with makeup. Just, like skincare, that kind of stuff is a little bit more intriguing now that I'm aging.
I know, right? It was just time to get real here. Guilty pleasure.
Guilty pleasure. Dairy Queen and a Dateline. Yep.
You might be my new best friend. Better than Netflix and chill,
100%.
When you put it that way.
Yeah.
What is it these days about murder mysteries and docuseries and true crime? I am obsessed.
I think it just makes you feel like you have your life together a little bit more than these people. So
right? I can be literally parenting. I can be multitasking, watching Night Stalker. Sometimes I think I'm disturbed, and then I feel better about myself that it's trending. Okay, speaking of trending, your practice, chiropractic care, I feel like we are finally getting in an era where it is more trendy to seek chiropractic care.
I would agree. However, that's part of why I went into the chiropractic profession, was because there still was this little bit of divide between medical doctors and chiropractors. And I wanted to kind of bridge that gap because I considered medicine for a long time and I really waffled. Do I want to be a medical doctor or a chiropractor? And I was just much more excited about chiropractic care. So I knew that was where I needed to go. But my mind was like, okay, how do I tackle this next obstacle, which is bridging that gap? Because patients really benefit from both. You need a little bit of this and a little bit of that. When I went to graduate school, how do I get into a place like Essentia Health and work alongside these medical doctors, educate these medical doctors on what chiropractors can do, and how do we work together for our patients?
I'm not sure if I've ever heard anyone say that, bridging of the gap, of the medical divide.
It's come a long way. And it's rooted in history between our associations years ago. We don't need to get into the details that way, but basically it came down to just lack of education. You know, we are a science-based profession.
Yep.
There are a range of chiropractors, but for the most part, a lot of us use the evidence and the science to support what we do. And I think if so many people struggle with low back and neck pain, why not utilize us?
Yeah.
The research says we're really good at helping with that. Let us help.
Let's step back a little bit further because we get into a little myth busting. And I'm not sure if there's many other areas of medicine that have more myths, and it's because of those decades-long feelings and thoughts with chiropractic care. First, I want to get into more Alli. Okay. Let's drop the white coat syndrome and get behind the stethoscope. How old did medicine fascinate you?
My mom would say young. I would get to stay up and watch ER on Thursdays at 9 o'clock.
Okay,
Dr.
this
Carter.
means, I was going to say, this goes back to the Clooney days. It has to.
Yes, I'm still not over Dr. Green. But she would say it like I would watch like the real ER on like TLC and stuff too. And I had my doctor kit, and we recently found an old notebook with all my patient records on there. All my Beanie Babies had different care. So I would say I was always interested in the health professions, the science, that kind of realm. I just didn't know which niche I would go for.
Let's fast forward to you finally figuring out the niche.
Oh, that wasn't until my senior year of college. I really struggled. You know, there's that prestigiousness with being a medical doctor. Could I do more good being a medical doctor than I could a chiropractor? And do I want to battle the, oh, you're not a real doctor as a chiropractor thing? But I just wasn't as excited for my medicine internships. I looked so much more forward to my chiropractor stuff. Me personally, I just aligned a little bit better with the chiropractic world. And once I finally said, like, I'm going chiropractic, it felt really good. It felt really right. But the more I looked into it, back pain has a huge prevalence in our population, and a lot of people are going to struggle from low back pain at some point in their life. Yeah. I can make a huge impact being a chiropractor if that's the case. Back pain is so debilitating, whether it's your pregnancy, you can't do laundry, you can't walk, you can't, it affects your mood, it affects your sleep, everything. So,
preach. I'm one with a bevy of back issues, so to the choir, you are preaching.
Yeah.
College, where did you go to school?
So I did my undergraduate at Concordia College in Moorhead as a cobber. And then I did graduate school down at Northwestern Health Science University in Bloomington, Minnesota.
Yeah. What is the family situation?
I'm married to another cobber. Surprise, surprise. He's his name's Mark. He's an occupational therapist at Essentia as well.
How fun.
And we have two little fur children, Sven and Oli. No human children yet. My mom will be happy to know it is in the future. It is coming.
Okay. Did you just give that drop in this podcast so it would appease your mom?
It would appease my mother. She will have grandkids in the future.
What kind of fur babies? You guys met in college?
Yes. We didn't start dating until after we graduated.
Oh, wow. Okay.
And he did grad school in Duluth, and I did grad school in Minneapolis. And I always thought we were going to wait till we were done with school to kind of do the whole wedding thing. But he surprised me, and during our last internship, he proposed, and we got married in 2018. And both got jobs here in Fargo, got a house. And
that feels very fresh.
Yeah, I mean, we're coming up on 3 years. I feel like that's decent.
That's a great thing. Both from around here.
I grew up in West Fargo, so everyone's
oh my goodness
within an hour.
Now, were you hoping to always stay in this area?
Yeah. I was okay going off for school. It just so happened Concordia was just across the river. And Minneapolis was fun for the time being, but West Fargo, it's always been home.
We're so fortunate to live where we live.
Yes, 100%.
For you to be in a world-class facility like you are, and your husband works there too at
I know.
Essentia.
It's so fun. So for me, as a chiropractor within a health facility, if I got a job offer, I was taking it, right? Like that was my dream job of what I wanted. And so I was like, honey, I'm staying here. So if you're coming with me, like you got to find a job. And there was an OT position open at Essentia as well. And so he applied and was able to get the job. So he's really special. He works in the hospital. So we're actually not in the same building, which is nice. We kind of have our own little world. But he does part-time in the NICU with the little babies. And then he does adults as well.
You can see why you're just like, just mushy.
Smitten.
Your passion was chiropractic care. You felt at home. And you started doing that. And your dream job.
So what I love about chiropractic care is we really get to the root of the problem. What is causing your pain? How do we fix that? And if we can't fix it, how do we make it better so that you're able to function, day to day. I work with my hands. I got healing hands. It's just so fun for me to have like that physical touch with patients. I think a lot of people are lacking that, especially right now with COVID. Really looking at the patient as a whole. What is their pain inhibiting them from doing, and how do we get some of those snippets of their life back? I'm always so surprised with how vulnerable people are when they're face down on the table. They tell me some crazy things. I don't take it lightly. It's such a privilege for them to like welcome me into their life. And because I see them so frequently, they update me on the job and the kids and the dog, and fun to kind of be a part of their life that way. I'll cry laugh with some patients. We just swap stories and that's so fun. And then my older adults, they give me advice on marriage and kids and things like that, which is fun too. I really just like the relationship I'm able to have with my patients. And I think I get to see all sides of them being a chiropractor. Yeah. I hear a little bit about everything and I can't address everything, but that's where being at Essentia is nice, as I can kind of direct them where they need to go.
I have to think that, again, that bigger team approach is very helpful in this situation. The outside wellness community, that's much harder to do for chiropractors out there.
Yeah, it gives me such a peace of mind. If I have a question, I just call up somebody. If I'm looking at an x-ray, I can call up radiology, or I can call an OB or a midwife. I can call neurosurgery, and I can just get their input, or they might say, hey, I want to see him first, and that's fine with me too. And I think it's good for the patient. They kind of get a comprehensive look, comprehensive team, feel like I'm doing good for my patients.
You can see the results too.
Yes, I can follow through, which is nice to kind of have that closure. Yeah, I tell my patients, I like to see you, but not all the time. Once in a while, like seeing you at Target is fine.
A little bit of a success story for you. My very first chiropractic experience goes back now over 14 years. This was my second pregnancy. I was experiencing for the first time sciatic nerve pain. Ooh. And it was terrible and completely debilitating. I'm already enormously pregnant. Turned on to physical therapy. I was wearing this insane belt to try to keep my pelvis straight, and nothing was getting me out of pain. Finally, someone said, have you tried chiropractic adjustment? Well, even 14 years ago, there was so much more myths going on. There was a lot of this, but that's what's crazy about pain. Pain will put you in a place where you start to get so vulnerable. Like, yes, I will try whatever you want me to try.
Do anything. Yeah.
And I got there. And the success was regular adjustments right away, down to weekly adjustments up until delivery. And I got completely out of my sciatic pain. Completely.
That's awesome.
To delivery with a 2-hour fast delivery.
Woo! Yeah,
it was nuts, but a perfectly healthy baby. And part of that delivery, the 2 pushes and you're out, 100% accredit it to an aligned spine.
Like, I love it.
When you have things open the way they're supposed to be, especially for, those expecting, and it changed me. From that point on, it was not only was I going to be seeing a chiropractor forever and always, but so were all of my kids. So
love it. Yes.
Isn't that so great? Yes. I mean, when people are still skeptical out there of chiropractic care, I'm like, you just got to try.
Well, and I'm glad you brought that up, because it's really common to know somebody who had a poor experience with a chiropractor. And just like anything, your financial planner, your hairstylist, whatever, there's different personalities and techniques, and find somebody you gel with and you mesh with and you trust. Yeah. And unfortunately, it can take a couple times.
It can. So finding that right person.
Yes.
And when you do, then everything feels right.
That's another thing I love about my job. People are usually pretty excited to see me.
You're in a good position. So let's talk little myths.
Okay.
Things have changed, especially over the last decade, 2 decades, in more accepting this as a practice, as a medicine, as pain relief for people. Are there still lingering myths out there that really annoy you?
I think the one that really gets to me a little bit is, well, once you start seeing a chiropractor, you have to go for the rest of your life. For me, I'm very much about, I want to see you, but not all the time. So let's get you out of pain and let's get you back to your life. And some people, they like the way they feel. They think they're able to manage their pain a little bit better and manage their headaches if they do see a chiropractor consistently. That's their choice. And I think just need my patients to be open with me when I talk about like what I'm thinking their treatment plan will look like. Is this something they're comfortable with? Is it feasible for them in their schedule? Do we have to tweak it? And some will bring up, can I keep coming? Yes. And some I see them for 4 times and I don't see them for a year and a half when they do the next thing that hurts. It's fine too. Everyone's different and there's no one size fits all.
I'm so glad that you broached that. That is still a very much out there myth.
Your back and your spine, you only get one of them, so take care of it a little bit.
And dang, you age. We talk about Father Time, undefeated. Like, you can't stop him. It's just going to happen. so many female providers, despite whatever their practice is, you have things that you wish more women knew about to take care of themselves. And maybe it's a practice you even do for yourself. Do you have a wellness nugget for us?
My go-to, your body is made to move. Get out, do a 20 to 30 minute walk 2 to 3 times a week. And women will say, well, I do that when I get groceries. No. I'm not talking about that. I'm talking podcast on, radio on, outside if you can, arms pumping. It's okay if you sweat a little bit. 20 to 30 minute walk. And it's going to do wonders for your back, your whole back. You use every muscle doing that. You're going to sleep better. You're going to feel better mentally. It is so important. Just
so great for your cardiac health too.
Yes, 100%. My other thing, and this isn't as readily easy for folks to do, but invest in a good mattress. That was the first thing my husband and I bought when we moved in together. And I don't know why we skimp on that, because you use it every day for hopefully 7 to 9 hours a day.
Yeah.
So get a good night's sleep, because again, that has so much effect on other aspects of your health. And if you can't afford a new mattress right now, at least flip it and rotate it from time to time, 6 months or so.
Those are good. Get a good mattress because invest in the things that your body touches every day.
Yes.
You can try to find a budget-friendly, cheaper option on the stuff that you just look at. You know what? My curtains, Target special.
Yep.
Right?
Yep.
Mattress good.
Yeah, my husband is very attached to our bed.
Dare to Ask is the name of the podcast. So I dare to ask, what do you say to me? I am a stomach sleeper.
Okay.
What do you do when your patients tell you that? It's like the hugest no-no, right?
Yeah, I might be kind of the black sheep of the chiros in this topic, because I'm more about getting a good quality night's sleep versus trying to retrain yourself and toss and turn. If you've always slept on your stomach, you've kind of adapted to it now. The best thing is if you're pregnant and you can get out of that habit, great. Postpartum and back to sleeping on your tummy. Again, if you're getting a good night's sleep and you're not in too much pain, okay.
Yeah.
If you're waking up with a lot of pain and things, then we might have to address that. I'm more about a quality night's sleep than anything.
I was not expecting you to say that. I thought you were fully going to scold me. Then our new friendship would be knocked down a few pegs. What are some of the fears you often hear from women when it comes to their back, their spine, their neck?
I think the biggest fear, and it's just so simple, is can you really help me? I don't have a lot of time to dedicate to this. I'm a mom, I'm a wife, I am working, there's needs at home, things like that. Do I have the time to commit to this? And can you really help me? Is it worth my time? I don't always know the answer to that. I try to be honest with patients and say, I've had good success with this in the past, but everyone's different. If you can't commit as much in the office, you might have to do more at home. We can easily facilitate that. But I think that's the biggest fear is, okay, I'm going to dedicate my time to this. I'm going to prioritize myself. Is it going to pay off for me? You want to be smart.
Do you have a favorite kind of patient?
All so special. I love expecting mothers. For me, that's such a happy form of back pain. Moms don't agree with me, but I think it's generally short-lived. It's likely going to get a lot better. We get a baby out of the deal.
Yeah.
Pregnant women are very easy to adjust. Hormone in your system called relaxin that just makes my job very easy. So I love my expecting moms. I love like my 3-4-year-olds. They're kind of fun too. My older patients, the sass, they're all fun.
You found something in every age group to take like a good takeaway.
Yeah.
It's like any parent. Every stage is great. Like, right? You find something you love. I always heard from my grandma, don't wish these days away. Is there a worse part of your job?
Well, the paperwork. The patient care is what's fun. I won't lie. Like when we get a nice pop cavitation, that's very satisfying as well. Yeah, I would say the worst part is the paperwork. I truly love my job. And I think most chiropractors just love what we do. Dr. Hager and I often come into our desk and we'll sit down and be like, how come everyone's not a chiropractor? And if you have questions or you have concerns, just communicate that with, any medical professional, but with your chiropractor too, because we've heard it all. Just talk about your fears. We can talk you through the treatment. And there's so many different ways to help you with chiropractic care. We can find something that fits well for you and what you're ready for and what you're looking for.
Because you are in the hospital system, do you need a referral to be seen by you?
Most insurances do not require a referral. However, it's very easy to get one if you're already in network with Essentia providers. A lot of them, if you use the MyChart, they'll just send in a referral for you and send us over. But for the most part, you can just look us up online, give us a call, and schedule a visit.
You brought up a really great point. Because you are in network
and add Essentia. To know that you're in that ability to take most insurances and in network, that is a huge help.
Yes, healthcare is expensive, and try to take the burden off a little bit by accepting insurance. And Medicare is another one. We see a lot of Medicare patients, and that's something that's harder to find in the community as well.
Okay. Alli, thank you so much. This has been a pleasure. You are a treat. Thank you so much.
Thank you.
Dr. Alli Klug, or Alli, as her patients call her, or Al, sometimes Al. She is an absolute joy. It's palpable, the energy that she gave off during that conversation. I can see why her patients love her and get vulnerable and real with her and talk about their lives whenever they go in for an adjustment. And ultimately, I think that that's my feeling on this entire 12-episode first season of this Dare to Ask podcast. My name is Corey Jensen. I've been your host throughout this journey, and I got to tell you, I'm a changed woman because of the privilege of getting to sit down and have conversations with these amazing female providers all through Essentia Health. I've learned so much, and I hope that you have too. This is one of those things where we have to bring it back. We have to do a season 2, and we're excited to do so. We'll cover more female topics. We're going to invite a couple guests back because of their wealth of knowledge. We just need it, and we'd love to hear from you. So drop a comment wherever you're listening to this podcast so that we can get you some answers. And it just might inspire the next episode on the Dare to Ask podcast. Thank you so much for joining us.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.